Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I am a psychiatrist working in UK. And I am doing some interviews from the successful IMGs who have been successful in securing a training post in UK. Because it is very important for the successful IMGs to come forward and share their inspiring stories for the next generation and also their advice. So I am very happy to see Dr. Vaughn with us, who is originally an IMG from India, who's currently working and as a ST1 in radiology. She only came to UK in 2020, but she was very quick to actually secure her training in radiology. So I thought it would be a very good chance for us to understand what the recruitment process looks like for radiology and what should we be doing, what should IMGs be doing to actually maximize their chances. So thank you very much for joining me. And that is it's a great service you're doing to actually speaking to the next generation of IMGs.
No problem at all. I think it's really great that you're doing this whole video series, and I really wish that I had seen this last year. It would have helped me so much.
And I just wanted to also mention to the IMGs that you also have a website or a blog, when you meant, which is called MBBS to NHS, and where you were sharing a lot of tips around the registration process, the PLAB, and all the initial struggles that and the IMGs go through. Do you want to talk about that now, and then we'll move on to the radiology?
Yeah, sure. So it's a blog that me and one of my best friends from college, her name's Ritu, and she's currently a GP trainee in Coventry. So we started that blog last year, just because when we first came here, it was very confusing. We had guidance from our seniors, definitely, but we thought it would be easier if, there was one spot that people could go to, get some guidance about it, which is why we started the blog. So it's more of how to approach PLAB, GMC registration, job applications, and that sort of thing. So please, we have an Instagram page as well, so please do like and follow.
And can you tell us a bit more about your journey as a doctor and you getting to this stage? What was actually happening?
So as you mentioned earlier, I moved to the UK in October of 2020. And I came here to join as a trust grade SHO in acute medicine. It's nowhere near radiology, but I think it's good to have some sort of clinical exposure to the NHS before you join any type of training. So I was interested in radiology from the time of my college. And so I sort of had a lot of things on my CV that was ready. So I just, didn't want to take too much of a break, and because I knew what I wanted to do, and applied in November of last year, and so managed to get in.
So the first thing the IMGs would like to know is that what is the recruitment process like in radiology? How will you apply, and what are the important things that will count towards them becoming successful in an application?
So the applications open in November of each year, and they're open for about a month. And then after that, so because when I did it, it was during the pandemic and we didn't have any in-person interviews. So during the application, you have a section called the self-assessment scoring, which is basically based on your CV, and you give yourself a score from that. So you do all that during the application. And then after that, in I think around early part of December, you'll be asked to upload evidence of all the things that you've scored yourself on, which will then be verified by radiology consultants. So after you've done that, you will then receive an invite for the MSRA exam. So I think I got that around the end of December, and then the exam was sort of end of Jan, beginning of Feb, somewhere around there. That you have to book a slot, which is convenient for you. After the the MSRA exam is done, and they release the scores of the verification of your self-assessment. And then after that, you get the invite for the interviews. I think mine was in March. I'm not exactly sure when in March. And after the interviews are done, they will combine all the scores together. It's not very clear what the weightage is, but I remember looking back on my scoring, I think the MSRA was roughly about 1/3 of the total score, but it was MSRA with your self-assessment score and the interview score, and they give you an overall score, and then they give you a rank. And based on your rank, you will be offered a training post.
And what was your personal experience of doing that when you actually applied for radiology? How did you do it? How did you prep for the MSRA, and how did you prep for the interview stage?
It was very stressful, I'm not gonna lie. I just did a lot of question banks basically, and definitely studying with someone helped me a lot. So for IMGs, clinical questions, yes, we'll be able to answer. We'll be able to study for, and answering that is, I'm not going to say easy, but it's something that we're more comfortable with doing. I found the situational judgment questions to be something very new. It's something that we are not exposed to as IMGs doing MBBS in India or wherever everyone's from. So I found that to be the hardest thing to prepare for. It's a lot of like ethical scenarios, and a lot of the options you'll be like, they mean the same thing. So I found discussing that with someone definitely helps. And again, doing the question banks, of question banks available online. For the interview prep, if you know someone, any of the senior radiology registrars, talking to them is a good first step. They'll give you a general idea of like how the interview scenario is and what kind of questions they were asked. And of course, the questions change with each year. It used to be that they actually give you images and you're asked to interpret them. Thank God I didn't have that. Yeah. They stopped doing that in the last few years. So definitely talking to seniors is one thing. There's again a lot of websites online which have sort of lists of commonly asked interview questions. So I went through some of those as well. And there is a Facebook group and a WhatsApp group. And last year they organized a mock interview. It was headed by Dr. Asim Khan. And they organized a mock interview with a lot of ST2s and ST3s who conducted it for us. And to be honest, I thought that was the most helpful tool, because not only do you practice your answers, you're grouped with other people, and you can sort of learn how other people are answering questions as well. And then a lot of self-practice. I used to record myself and listen to how I sounded for my answers, and then just do it again and again.
And so when you had the experience of the online interview, so how many stations did you face? Was it just one station, or there was a multiple station process?
So how we did it was different then, because it's the first time it was online. So it was just one station. I had 2 interviewers, and I think it was about 4 or 5 questions, totally about 15 minutes. I know in the previous years they had portfolio stations and things. We didn't have anything like that. It was a mixture of personal questions and ethical scenarios, but it was totally only 15 minutes.
All right, to 15 minutes interview with 2 consultants, and then you just have different scenarios there. Then you also mentioned something called self-assessment, a self-scoring system. So obviously you need to be able to score good marks on that. So is there anything that you will advise the IMGs? What were the things you found that the IMGs can do to score well on that particular part?
So what helps is if you look through, so the self-assessment scoring criteria changes slightly every year, from what I've seen. So just keep, I would suggest to everyone, just keep an eye on how it's been, so you have a vague idea. Obviously as IMGs, as far as I know, we don't really do that many other postgraduate courses or other extra undergraduate courses. So that's something which I think we lack compared to UK graduates. So as compensation for that, what we can focus on is things like audits. It's not given that much importance in foreign countries, but if you know that you want to come to the UK, it's very, very valuable here. So it's something you can try and do back in your home country as well. Any sort of teaching experience helps as well. And there's also a lot of online courses which you can do for the teaching experiences as well. And the other thing that I would say is, right, so here they call it a taster week. Basically, it's like an observership. Now, it's not something that's mandatory, but it's something that has a score on, at least when I applied, it had a score on the self-assessment. And basically, so you don't have to do it in the UK. I didn't do mine in the UK. I had my experience in a different country. But how it works is if you do decide to come to the UK and do it, is you talk to your radiology department about basically just staying in the department for about a week, observing consultants, observing registrars, and you can use this as an opportunity to help in audits or any type of research which may be going on. So that's a huge plus point to get done. I think those are the three main things that IMGs can focus on.
So you are basically saying that the IMGs need to read the self-scoring criteria first, and it's good to sort of have that knowledge in advance and start to, if they're targeting the ST1 application, they start to start doing those things which will give them the marks and on those assessments, and also try to be scoring well on the MSRA, which they might struggle with.
Yeah, I think that's the two main sort of bottlenecks in the application process. I'm not sure if the self-assessment score is available online to people. I don't think it is. So I think the best thing to do in that situation would to just be speaking to like other ST1s and ST2s, and they can give you an idea on how their self-assessment score was. But this is sort of, from what I could see, this accounts for a fair amount of points.
Thank you very much. What about if I ask you, I'm sure a lot of people might be asking you, what are the advantages of working as in this particular specialty? What is that you gain from becoming a radiologist? Or if I put it more simply, if you have to sell this specialty radiology to medical students or junior doctors, what will you say to them?
Well, apart from, yes, it's a really, really great specialty. I will get into that. I would say only go into it if you genuinely like it. I really like anatomy, so this was one of my choices from first year of college. So you need to actually be very interested in it to decide to have a career in it. Apart from that, I know the first thing that everyone thinks is it's very relaxed. As an ST1, I will agree it definitely is. Work-life balance is really good so far, and compared to the other training specialties, it stays pretty good throughout training as well. Obviously, as a trainee, you can't do work from home, but I know a lot of consultants who can. So you've got the benefit of, doing your job, sitting in the comfort of home. You can do a lot of, I think there's tele-reporting, so you can report for other countries as well while staying here. The only drawback which I felt was, because I've worked in acute med, which is very, very, it has a lot of interaction with patients. And now being in radiology, there's very, very, I wouldn't say zero, but there's very, very less interaction. So a lot of people may find that a little bit difficult in the beginning, but then you get used to it. But keeping all that in mind, I'm not saying training is easy. Definitely not.
And I'm sure this people will ask you, must be asking you this as well. For people like me who haven't worked in radiology, it might look like a single specialty that is only one kind of a doctor in that field. But I'm sure there are subspecialties that you know of. So if can you tell us about something about some of the subspecialties which the doctors can sort of think of when they are specializing in radiology?
Yeah, so when you come into radiology, I would basically put it as three main specialties. You can either stick to diagnostic radiology, which will include most of your training will be in diagnostic. There's interventional, which is it's a lot of hands-on, you do a lot of procedures, you get a lot of emergency calls as well. And then there's nuclear medicine, which is another super specialty in that. In diagnostic, again, you can specialize into different systems. You've got like neuro, MSK, pediatric, chest, body. There's so many. Sorry if I left any out. But that's broadly speaking, that's the different ways you can specialize.
And some IMGs are interested in to teach, and they will always ask this question: that is this specialty has a branch when they can go and teach in the medical school as well, and have that experience of becoming a medical educator. So have you seen some examples there as well?
I'm not really sure about medical educator, but I can say, so I'm currently in Stoke-on-Trent, and the hospital here is affiliated with Keele Medical University, and radiology does play a part in the teaching of anatomy to medical students. So I think weekly they have sessions with one of our consultants, and even us as trainees, we have given some online teaching for medical students as well. I'm not really sure beyond that. I'm sure if you join teaching, teaching hospitals, you have obviously a lot of trainees to teach, and you will have medical students who come on rotations. But I'm not really sure beyond that how it would go.
And if I'll ask you at the end, if somebody who's at the medical student stage, or they are junior doctor back home right now in countries India, Pakistan, Bangladesh, Sri Lanka, and they are thinking about coming to UK, and they are also doing their PLAB, the process of PLAB and all that. What would be your advice to them if they want to pursue radiology? What kind of things they can do to sort of improve their chances? You did mention that having some experience, obviously having, even if it's only to experience to shadow or only for a small number of time. But is it anything else that you think would be helpful for them?
Like I was saying earlier, I think as it is a training job, I think jumping into a training job as a first job in the NHS is probably not a good idea, just so you can understand the system and understand how things work. To work for a while is non-training. I myself worked for about 10 months. I think it helped me a lot. Another thing which is not really something to do, but something which affected me a lot was a lot of people told me that getting radiology as an IMG is practically impossible. And it definitely demotivated me, and I was sort of wavering between should I apply or not apply. And it was a very last minute decision with my friend telling me just give it a shot, because I've worked on my CV and I have everything I need. So I just want to tell the IMGs that it's not impossible. If it's what you want, you can definitely work towards it and you will be able to get it.
And any other general advice for the young IMGs, because you are already running a blog and you are already in the scene of helping people. Do you get any common questions or anything that you like to share your experience with them?
A lot of people have asked me like how is it, moving to a completely new country, and it's not easy in the beginning, but it's a very different culture. Even the work culture is very different than what we're used to back home, but it's something that you will get used to.
What does your week practically look like? Because this is something people would be interested in, from Monday to Friday, and then if you can tell us a bit about your on calls as well. What does it practically look like?
So I'm an ST1 right now, so we don't actually do on call, so I can't really talk too much about it. But I think ST1 radiology probably has one of the steepest learning curves, because you would have never worked in radiology as a radiologist before, so it's all very new. So we have a lot of teaching in our week. My department's really good in that they've organized quite a lot of teaching. So my work timings right now is 9 to 5, and we either have some teaching, if not, we'll do some reporting. So in the beginning, it was more of shadowing the consultants for a few days to just see, they'll sort of walk you through, like how to report and how to start looking at CTs or plain films or whatever block you're on. And then eventually you start doing it on your own. So half a day is usually in some form of teaching, either physics or anatomy, or we sometimes have CT teaching. And then the other half sometimes goes in ultrasound lists. We can have a few hours of MDTs. or it's just reporting and then discussing with the consultant, you know, how you've reported and how you can improve beyond that. So that's usually how our Monday to Friday goes. And like I said, we don't do on calls as ST1s yet.
Okay.
And then when I get back from work, it's a lot of studying. It does sort of feel like you're back in medical college. I'm not gonna lie. I've actually got like a timetable here on like what I should be studying each day, because we do have our FRCR exam coming up in March, so it's definitely a lot of studying for that.
About the exams, I was going to ask you that how many parts of the fellowship exams are there, and and how long is the training time that you have to do them within?
So FRCR is the exam that we take, and there's part 1 and 2A and 2B. So part 1 is physics and anatomy, and you take that in your first year. So we started in September and I have my exam in March. Part 2A, you take it in 3rd year, and part 2B, you take it in 4th year. So that's the overall plan of it.
And they are MCQs exams, or there are some practical exams as well in between?
They're mostly MCQs. I think 2B has some hot reporting, which is sort of like a Viva, but a lot of it is sort of like true or false kind of questions. Part 1 is just true or false questions.
Okay. So thank you very much for speaking to me and sharing your experience and all the amazing tips you have shared for the IMGs. And the message you gave, which was very important. If they are looking for one specialty, don't get demotivated without trying. You should always give it your best shot. If you like something, you should. There's always ways around getting into that specialty. Nowadays when the visa process is more open for IMGs, things are easier. Even when the visa process wasn't that easy and people have to sometimes uh, take other routes, or wait for the ILR. Even then, the IMGs were actually getting all the specialties if they were working hard and showing that degree of energy that they want to go into one particular specialty. So no, thank you very much for joining me.
No, thank you so much for asking me to do this with you.
Thank you.
All right.